And hello, hello, hello. Welcome to our nursing news you can use at 5. I'm Tina Baxter, your host. Thank you to those of you tuning in from our YouTube channel and those that are watching us on the Facebook Lives. Thank you for joining us. We're going to get started with our affirmation for today and just talk a little bit about what's happening. So, I am at peace even in the midst of chaos. No person, place, or thing has the power to upset me. I am at peace even in the midst of chaos. No person, place, or thing has the power to upset me. So, this is our affirmation today from the affirmation calendar from Louise Hay. And I chose that one today because today has been chaos. Uh, those of you know, in a Baxter Professional Services Health Education, we have CNA training going on right now with our CNAs. And we also continue to have our TB classes and CPR classes and all this stuff going on Wednesdays. And then, of course, we have our live show to get ready for every Wednesday. And between all that, and I say that to say that in the midst of all this chaos, it doesn't get to me. I continue to have fun and I love what I do, and it gives me energy to be here. All right, so let's go ahead and get started with the news because we've got a few things to cover. And so this is our first story coming from McKnight's long term care news. And it says 83 million fraud case against nursing home group may proceed with no defendants excused. A New York Supreme Court judge threw out all arguments from lawyers from an embattled group of nursing homes that sought to have charges dismissed in a case accusing the owners and operators of 83 million in Medicare and Medicaid fraud. Judge Melissa Crane ruled that the owners of Centers Healthcare, along with numerous other individuals, did not make sufficient arguments for dropping charges of fraud, quote, adding saddling nursing homes with excessive debts, colluding to pay sham vendors, and paying themselves inflated salaries. The facility's lawyers also sought to have 11 defendants dismissed from the case, but that too was denied by the judge. The petition sufficiently alleges that the respondents repeatedly engaged in fraud and illegal behavior by filing false and misleading Medicaid certifications, violating other Medicaid program regulations, paying fraudulent and collusive fees to related party service providers, and orchestrating fraudulent real estate schemes based on fraudulent loans. She found that the group of 11 identified as nursing home owners may be held liable under state law. New York Attorney General Letitia James sued Centers Healthcare in June of 2023, alleging repeated and persistent fraud, illegally misusing more than $83 million in taxpayer money. That allegedly resulted in significant resident neglect, harm, and humiliation at four for-profit nursing homes in Queens, the Bronx, Westchester County, and Buffalo. In April, the Albany Times Union reported that the Center's Plan for Healthy Living, also owned by Chief Executive Officer Kenneth Rosenberg, was awarded a 5-year, multi-billion-dollar contract with the state. A spokesman for Center Healthcare declined to comment on Tuesday, citing the ongoing litigation. So here is what we have. The state is now suing these nursing home owners for allegedly making, I guess, some backroom deals and some sham vendors for services that probably were not rendered. But let's kind of get into it because there's a little bit more, and I want to make sure that I'm not saying anything that's not in the article. I haven't had a chance to read the entire case or know the case files. It is a pending litigation. But here is what they said. So James said the individuals in the lawsuit put into place multiple ongoing illegal schemes to divert money that should have been spent on the nursing homes themselves. She claims the facilities were forced to enter into collusive real estate arrangements that saddled the homes with excessive debts and forced them to pay falsely inflated rents to real estate companies owned by Daryl Hagler, who is also named in the lawsuit. So I remember we talked in previous cases about how oftentimes for-profit entities will buy the nursing home, sell the land out from under them, and sell it back to themselves. So now they can charge rent to the nursing home that they own. So they're actually, that's a way of kind of siphoning off the money. All right. So it says the facilities were also forced to make interest-free loans to other nursing homes, all owned and operated by Rosenberg. for no discernible business purpose, per the lawsuit, which noted that the loans were rarely repaid. The defendants also accused of paying salaries to themselves that were frequently unreported, inflated, and in some instances indicative of no show jobs. So when they say no show jobs, basically there were shadow jobs where they actually weren't performing the service or working. They were just kind of getting paid for being on the books. So in July of 2023, McKnight's reported that the lawyers for Centers for Healthcare squared off in court against James' office over the boundaries for a court-appointed independent monitor who would have access to historical, patient, and resident records. Crane ruled that the review would continue, but James would not be able to use any of the monitor's findings in its case. James alleges that diverting funds from 4 nursing homes led to the facilities being underfunded and understaffed, resulting in negligent conditions for residents who did not receive proper medical care or hygiene. So the original 318-page petition claims that the residents suffered serious injuries, malnutrition, and infections, sometimes leading to the death at 4 facilities. So there's more information for that. So if you want to read more, head on over to McKnight's Long-Term Care News. Just keeping you up to date on what's happening as we're seeing more and more of these cases come out in the future. All right. So this is a story that I happened on. It's coming out of Maine. This is from the Daily Bulldog out of Franklin County. And I thought this was interesting and I wanted to share this. So this was published on the 25th, and it says Maine monitor, a Maine nursing home owner, has been in business for nearly 50 years. He wants out. At least 26 nursing homes in the state have closed in the last decade. So that's in Maine. A rate reform process underway that will update payment method models and is intended to improve quality of care. That's good. As president of Caribou Rehab and Nursing Center, Phil Sire begins each morning walking the hallways, greeting every employee by name. The walls of the Aroostook County Nursing Home are full of local historical images compiled by Sire's daughter and nature photos taken by his older brother, Paul. The conference room where new employees are trained is called the Bear's Den, decorated with photos of black bears that Paul Sire staged in funny scenarios by luring them with dog food to sit at a picnic table or stand behind a camera tripod. There's also a fabric black bear head mounted on a wooden plaque. Phil Sire considered mounting a real bear's head, but the nurses blew a fuse, he said ruefully, as they should. On a summer morning, the home was bustling. A physical therapist guided a resident, a worker sorted through clothing, maintenance employee vacuumed the carpets. In the dementia wing, a resident in a wheelchair greeted Sire while using his feet to pad forward into his room. Howdy, Sire replied. The busy atmosphere stemmed in part from the closure of another nursing home owned by the Sire family, Presque Isle Rehab and Nursing Center, which transferred its last residents this week. 30 residents and 15 employees moved from Presque Isle to the Caribou facility, with the rest of the residents going to other nearby nursing homes. The Presque Island home had been hemorrhaging money because it couldn't find staff and had to operate at 60% capacity, Sire said. From March to May, Sire estimates it lost $250,000. We closed one home to save the other, he said. At least 26 nursing homes in the state have closed in the last decade, and there are increasing challenges for family-run facilities competing against large chains. There are currently 79 nursing home operators in Maine, which has the oldest population in the country. A recent report from the Federal Reserve Bank of Boston found that since fiscal year 2010, nursing home closures in New England have outpaced the rest of the country, and Maine has the highest rate. Sire has been in the nursing home business for nearly 50 years. He and his family at one time owned 3 of them in northern Maine, with his parents and 5 siblings all involved in some form. Now he is the only family member in the business, and Caribou is the only facility still operating. That may not be true for long. Sire openly talks about selling the Caribou facility and getting out of the business altogether. He says running a nursing home has become increasingly difficult due to complex regulation, statewide staffing shortages, and low reimbursement rates. In the 1970s, Caribou made about $150,000 in profit annually, which is more than $800,000 in today's dollars. Now, Sire says it's a challenge to break even, noting he recently took out more than $1 million mortgage in the Presque Island facility to recoup the losses from both homes. Maine is in the process of reforming its nursing home reimbursement rates. The change is set to take effect in January and intended to update how nursing homes get paid while incentivizing better quality care, higher occupancy levels, and reduced reliance on temporary staff. The approach includes tying some portion of the payment to staffing levels, clinical outcomes, resident satisfaction, and high main care utilization. The current state budget includes $39 million in allocations for the rate of reform and an additional $72.8 million as part of the 3-year transition fund. To Sire, the allocations haven't made up for what he sees as years of underfunding nursing homes while increasing regulations. He thinks the new requirements proposed through the rate reform could force more nursing homes to close. So again, this is a sticky situation, particularly for privately owned, family owned nursing homes. It is hard for them to sometimes um, stay afloat. So there's more to this story. Wonderful pictures. Looks like a great facility. Looks like a place that I probably want to work at. I don't know what they're paying their staff, but it's a shame when you have some of these homes that have been around for a long time, and you have facilities that really work hard to do well, and it's hard for them to maintain their doors open. So this is a concern that we should have in the healthcare community of who's going to take care of our elders and where they're going to get the care that they need. All right. So that brings us up to our next article. This is from Healthcare Dive. And it says OIG, that's Office of Inspector General, estimates 1 in 4 for-profit nursing homes not complying with infection control staffing rules. So about 1 in 4 for-profit nursing homes across the country are likely not complying with federal regulations surrounding infection control staff, increasing health and safety risks for residents and workers, according to an estimate by the HHS Office of Inspector General. In a report analyzing a sample of 100 facilities, 17 potentially didn't follow the rules that require an infection preventionist, a staffer responsible for managing the nursing home's infection control and prevention policies, to complete specialized training before taking the job. So in other words, they're putting people in place, but they might not have the training to know how to do the said job. 7 nursing homes potentially failed to designate infection preventionists entirely, the OIG said. More than 1.3 million people live in nursing homes nationwide, according to the OIG's report. These patients are more susceptible to infections given that they're often elderly or medically fragile and live in close proximity to other residents and staff. So, for example, COVID-19 tore through nursing homes during the early days of the pandemic, killing patients at an outsized rate and overwhelming facilities. More than 172,000 residents have died of the coronavirus, and millions have been infected, according to data from CMS. To improve safety and quality in long-term care facilities, the CMS in 2016 implemented new standards that required nursing homes to establish an infection prevention and control program and designate at least one person who would be responsible for that plan. Now, this is in 2016. This is pre-pandemic, that they had already saw that this is a problem and they wanted to put this in place. So this is kind of where I want you to see this isn't just a reaction to the pandemic. They already were forward thinking about these things and wanted this stuff in place, but the pandemic happened and they found out that people were not aware and were not compliant. So the program had to include a system for preventing, identifying, and controlling infections, an antibiotic stewardship program, and a plan for recording incidents and taking corrective actions. The infection preventionist was required to work at least part-time and to complete specialized training in infection prevention and control. But some nursing homes failed to comply with these rules, according to the report. 6 nursing homes in the sample didn't have a designated infection preventionist for part of the audit period, which ranged from 30 to 311 days for 5 of those facilities. 1 nursing home didn't have a preventionist for any part of the study period. Officials at the nursing home said they failed to comply with infection staffing rules due to challenges hiring and retaining qualified workers, as well as significant changes in ownership, administrators, or infection prevention staff. They also reported problems accessing statewide in-person or online training and problems completing the training in a timely manner due to work demands or changing regulatory requirements. And so there's a lot that goes into the training, and they really should look into how to implement that on a statewide basis. Again, staffing has been a challenge. Before the pandemic in 2018, 23% of nursing homes used temporary agency staff, accounting for about 3% of all direct care nursing hours. But in 2022, nearly half of nursing homes use agency workers, making up 11% of all direct care nursing home or nursing hours. So this is more information in this article. Please head on over to the article there and check it out. This is the first time I've gotten some from Healthcare Dive, and it sounds like good information. All right, let's bring it a little bit closer to home. We've got a couple of stories that are talking about something happening here in Indiana. So we'll go ahead and take a quick break, and then we'll get into those stories right after this. My mission is for you to own your seat at the table of nurse entrepreneurship, gaining confidence, skills, and freedom to live your life on your own terms. I specialize in working with nurses and other health professionals who want to reduce burnout, pessimism, and compassion fatigue. So you can become a successful entrepreneur to reclaim the love you have for your profession and to create a fulfilling and prosperous life. Join the Nurse Shark Academy at thenurssharkacademy.biz and come feel the sun, providing a clear path for business success. And we are back. I had to stop and get a big drink. Because I've been talking for a long time today. So let's get into it. So this is coming from the Daily Advocate. And it says Reed Health joins nurse residency program. So this is coming out of Richmond, Indiana. Reed Health announced it has joined the Vincent and American Association of College of Nurses nurse residency program to ease the transition of newly graduated nurses to clinical practice. The program, which welcomed its first class August the 5th, promotes quality, safety, and reduces turnover for first-year nurses. Misty Ford Cofield, Vice President and Chief Nursing Officer, said the cohort will include graduating nurses and RNs within their first year of nursing who have been hired by Reed Health and have Indiana licensing from an accredited college or university. Surgery nurses and non-traditional graduate nurses who haven't practiced in acute care can also participate. Reed Health is thrilled to welcome its first resident nurses to the team. The nurse residency program allows us to support and mentor our new nurses as they begin their careers and will benefit our patients. The nurse residency program is an initiative of Reed's Nursing Excellence, Resilience, and Development, or NERD, department, which offers continual training and education for nurses, nursing care assistants, and nursing students to provide high quality care to patients. More than 20 nurse residents started with Reed's Health System and the care team during a 2-week orientation on August the 5th. The nurse residents are now beginning the first of 12 monthly seminars to complete the program in a year. Reed topic experts facilitate the monthly 4-hour seminar. The nurse residency program increases the mentorship, engagement, and support for first-year nurses by connecting them with a trained preceptor. Resident nurses will expand their skills with hands-on learning and training with the NERD department as they cover workplace topics focused on well-being, management, and professional growth. Anna Osborne Brown, Senior Director of Nursing, said the NERD program carefully developed the curriculum to set its first-year nurses up for success and to have long, fulfilling careers. Nursing is a demanding profession that calls on you physically, mentally, and emotionally, Osborne Brown said. The more we can build our nurse residents' foundation with support, tools, and skills now, the more quickly they will transition to their new role and meet their goals for professional nursing and patient care as well. So congratulations to that. We'll see how it works out with their nurse residency program. And I think that's a good thing because I think some of the nurses that graduated during the pandemic, unfortunately, weren't given that opportunity to have that training and that cushion before they were thrown out there. And we were in the middle of a public health crisis. So I understand how that happened. So a lot of those new grads ended up burning out. So if this is a way we can keep them, that sounds great. So here's another story that I happened on today. This was a Fox 59 report, And it says the impacts of forensic nursing and how a federal grant will expand services. This kind of made me a little excited to hear about this. And it says, according to IU Health, as of 2020, only 32 of Indiana's 92 counties had a forensic nurse. That's why leaders hope the recently announced $1.39 million federal grant will address the rise in forensic nursing shortage and help them to expand to other counties. These nurses are on the front lines handling rape cases and other sexual assault cases. With more than 480 sex crimes committed locally so far this year, IU Health shares that they're hoping individuals interested will take part in their mission to train more than 300 forensic nurses over the next 3 years. So I wanted to share this in case you are interested in forensic nursing and you are a nurse out there. Let me know and I can give you the link to this article. Again, it was on Fox 59. There's more information on how to get into the program and what the program is about. But if you're interested in that field, I think that's a great field to be in. I mean, it's sad what you do, but it's so helpful what you do. Let me know, and I'll happy to share that information with you. All right, let's get to our next story. And this is kind of interesting. This is from the world of academia. This is from California Healthline, and it says UCSF favors pricey doctoral program for nurse midwives amid maternal care crisis. So let me know what you guys think about this. So nurses, particularly midwives and those that are in L&D, let me know what you think about this. Okay. So one of California's two programs for training nurse midwives has stopped admitting students while it revamps its curriculum to offer only doctoral degrees, a move that has drawn howls of protest from alumni, health policy experts, and faculty who accuse the University of California of putting profits above public health needs. So, UC San Francisco's renowned nursing school will graduate its final class of certified nurse midwives next spring. Then the university will cancel its 2-year master's program in nurse midwifery, along with the other nursing disciplines, in favor of a 3-year Doctor of Nursing Practice or DNP degree. The change will pause UCSF's nearly 5 decades long training of nurse midwives until at least 2025 and will more than double the cost to students. State Assembly member Mia Bonta, who chairs the Health Committee, says she was disheartened to learn that UCSF was eliminating its master's nurse midwifery program and feared the additional time and cost to get a doctorate would deter potential applicants. Instead of adding hurdles, we need to be building and expanding the pipeline of culturally and racially concordant providers to support improve birth outcomes, especially for Black and Latina birthing people, she said in an email. The switch to doctoral education is part of a national movement to require all advanced practice registered nurses, including nurse midwives and nurse practitioners, to earn doctoral degrees, Kristen Bowley, UCSF spokesperson, said in response to written questions. The doctoral training will feature additional classes in leadership and quality improvement. But the movement, which dates to 2004, has not caught on the way the American College of Nurses envisioned when it called for doctoral level education to be required for entry level advanced nurse practice by 2015. The deadline came and went. Now, an acute need for maternal health practitioners has some universities moving in the other direction. This year, Rutgers University reinstated the nurse midwifery master's training it had eliminated in 2016. The University of Alabama Birmingham also restarted its master's in nurse midwifery program in 2022 after a 25-year hiatus. In addition, George Washington University in Washington, D.C., Loyola University in New Orleans, and the University of Nevada, Las Vegas added master's training in nurse midwifery. UCSF estimates tuition and fees will cost $152,000 for a 3-year doctoral degree in midwifery compared to $65,000 for a 2-year master's, which I find is quite interesting because I was talking to some nurses that trained outside of the U.S., and how their training goes is that you choose a specialty. And so you may choose nurse midwifery. And so you are trained at the baccalaureate level for some of this. So they were doing things back home that they can't do here in the U.S. So I find that interesting, what's going on. So let me know what you all think. The midwives out there, what do you all think about this trend? Of course, I've heard about, they're now requiring, DMPs for a lot of MPs and things like that. And those of us who don't have it and graduated in, grandfathered in and that type of thing. Um, I think, I think that in some way it may be a good move. In other ways, I do have reservations about this. I mean, it's expensive to go to graduate school, and to add that additional burden onto someone who would be able to practice as a master degree level, I don't know. So I have mixed feelings about that, but certainly you can talk about this. So, nurse midwives, for those of you that are listening who are not in the healthcare field, are registered nurses with graduate degrees in nurse midwifery. Licensed in all 50 states, they work mostly in hospitals and can perform abortions and prescribe medications, deliver babies, um, and other things. Then there's certified midwives, by contrast, who study midwifery at the graduate level outside of nursing schools and are only licensed in some states. Certified professional midwives attend births outside of the hospitals. So those are some of the differences. So if you're wondering about that with midwives, those are some of the differences. So certainly read. There's more to this article. Feel free to read it. But I just have some concerns about this and questions on whether it's actually necessary. Okay, here's another story. It says from 6 News in Richmond, Virginia man disheartened. It took the state 8 months to investigate horrifying nursing home conditions. Okay. Steve Lambert reflected on better times, showing CBS 6 photos of his brother Winfred smiling and surrounded by family. We were having a gathering here, one of his more happier days, Lambert said. He loved laughing. The memory is a stark difference from the one Lambert has from December 16, 2023, when he visited his brother at Westport Rehabilitation and Nursing Center in Henrico County. Winfred had just been admitted to the nursing home the day before in declining health. Um, so basically, they said they came in. His gown was basically barely on him. It was on one shoulder. He was in the pen. Winifred found him face down in his bed with his gown night covering him and his adult diaper exposed. Lambert said his brother could not move himself due to muscle loss and could not speak up for himself due to an intellectual disability. I cried. My wife and I cried, Lambert said. We sat him up in bed and he started crying. Lambert was also concerned about particles he found in vents and large flakes of what appeared to be somebody else's skin. We looked around and there were large chunks of dead skin on the windowsill, on the floor, and all over his bed. Oh, ow. And there's pictures too. Mm. I'm not going to show the pictures. They're kind of graphic. I'm not going to show them. But there is a picture of him lying in his bed, his back exposed. He's not covered with a sheet or anything. In his depends, all exposed. That's terrible. Lambert understands facilities like these must adhere to government standards and federal regulations on the care and safety of patients because he was an associate director with the Virginia Department of Social Services Licensing Division. In that role, Lambert was responsible for overseeing adult services and enforcement and was involved in the process of inspecting facilities for alleged violations of state standards. He said, and based on his professional experience, I found the condition that my brother was in, as well as the gentleman that was in the room with him, totally unacceptable. So the very next day, on December 17th, Lambert submitted a complaint to the Virginia Department of Health, the agency responsible for inspecting nursing homes as part of the Centers for Medicaid and Medicaid Services Survey and Certification Program. He submitted another complaint on December the 23rd, alleging Winfred, who had compromised respiratory system, was placed in a unit for COVID-19 patients and then contracted the virus. CBS 6 contacted Westport multiple times requesting a response to the allegations in Lambert's complaint and has not yet heard back. However, months went by without any action from VDH. He says, I find it very disheartening that the Department of Health has not responded. On March 23rd of 2024, his brother died. Lambert's brother died. But he was determined to have his complaints investigated. Lambert checked in with the VDH in March to request an update and was told his complaint inspection was pending. He checked again in July and they're still pending. At that point, VDH's Director of Office of the Licensure and Certification, Kim Belize told Lambert in an email that her office had received, quote, a large number of nursing home complaints and was grappling with a number of vacancies. CBS 6 confirmed through public records requests that the office is currently down 19 long term care medical facility inspectors out of 48 positions, a 40% vacancy rate. My response would be, well, what are you doing about it? Lambert said. VDH used an intake prioritization system from CMS to determine how quickly it should investigate complaints. The timeline separates allegations into immediate jeopardy, which requires a response within 3 days, and non immediate jeopardy. Depending on the severity level, allegations that fall into non immediate jeopardy category require inspection in 15, 45, or the lowest severity, potentially during the facility's next on site survey. So, again, it could be months depending on the level of problems. Okay. So, they wouldn't confirm how Lambert's complaints were prioritized and referred questions to CMS. A CMS spokesperson also did not confirm how Lambert's complaints were prioritized. CBS submitted a public records request to the federal agency for complaint prioritization. I'm sorry, I just talked a lot today and I'm very tired. And a response is still pending. So even if the alleged noncompliance was assessed at the lowest severity level, which meant no actual physical or mental harm had occurred, CMS records show VDH inspected Westport in February this year, 2 months after Lambert's complaints were submitted. So during the February inspection, investigators found the facility failed to implement a resident's comprehensive care plan, which required repositioning the resident in incontinence care. CBS 6 asked VDH whether Lambert's complaints should have been a focus area during the February survey, and a spokesperson did not answer that question. So there's more to this story, but he is pushing forward. It was found that Virginia ranked 47 out of the 50 states for completing recertification of nursing homes on time, which are required every 15 months. Only Alabama, Kentucky, and Maryland had higher percentages of uninspected providers. So I wanted you to, as a lay public, to understand what's happening and also know, hey, check on when your state's getting their surveys done. And then also for facilities to know what's going on. So Westport did receive a 1-star rating according to this report. All right, so let's talk about something just a little bit more happy. Well, maybe not happy, but this is maybe a good move. But it says Central School of Practical Nursing has a new owner and will move to Superior Avenue. So this is coming out of what state is this? Cleveland, Ohio. There we go. So the Central School for Practical Nursing, the oldest nursing school in Ohio, has been acquired by the Healthcare Workforce Development Organization, Newbridge Cleveland, and will relocate to the city. Newbridge Cleveland said in a news release announcing the acquisition that it plans to move the school to 4050 Superior Avenue, the location of the former Case Elementary School, a 66,000 square foot facility it acquired in July. Central School, which was founded in 1937 and trains about 100 licensed practical nurses a year, is currently in Independence at 4700 Rockside Road across the street from Cleveland Clinic Family Health Center. Newbridge said the move would position it to grow Central's nursing program and described the location as a hub for advanced healthcare training, fostering collaboration and innovation in the field. Newbridge Cleveland was created in 2010, a workforce development organization, healthcare training. Bethany Friedlander, president and CEO of Newbridge, said in a statement that this partnership would allow the organization to provide comprehensive student support and placement services, as well as its unique educational approach. We are addressing the critical need for skilled LPNs in Cleveland's hospitals and long-term care facilities. Chandler Everett, the board chair of Central School, said the collaboration could broaden career opportunities and address personal objectives for our students, as well as a number of our community needs. So I'm just going to say congratulations. They're not closing. They've been acquired and they're carrying on. I think that's wonderful. Okay, and here is our last story for today. Again, just a little bit more uplifting story. This is from WRTV Indianapolis. And it says it's never too late to pursue a career later in nursing later. So there's a large need for nurses in Indiana right now. Yep. The ongoing shortage in our state and across the country has been well documented, and the U.S. Bureau of Labor Statistics estimates the need will grow in the next 10 years. That's one of the reasons Kristen Kleckner wants to go into the field. Kleckner has a carnation tattoo on her wrist in honor of her best friend's daughter, Abigail's birth flower. Abigail unexpectedly passed away last July. All of our kids grew up together, so it was like we lost our own, Kleckner said. Deep down, she always felt something was missing. I thought my age and duration on the earth would be a hindrance. For once, I'm actually finding it's my strongest characteristic. She says Abigail taught her to do the things that scare you. In the wake of her death, Kleckner chose to follow her own dream. She's becoming a nurse. I just ripped the band-aid off and I'm doing it, Kleckner said. Kleckner is a current student in the Accelerated Bachelor of Science in Nursing program at Marian University. It is a 16-month program geared towards those who already completed some or all of a college degree and may be working in another field. The continued shortage of nursing that's happened across the country, that's anything immune to Indiana, said Regional Chief Nursing Officer for Ascension, Ascension St. Vincent, Jill Payne, said Indiana will be short 5,000 nurses by the end of the decade, according to the Indiana Hospital Association. We want people who represent our community. We want people who look like the communities they live in and have the ability to take care of those that are in need, Payne said. Kleckner will be one of those people next summer. Most of my friends at this age are talking about retirement, thinking about their retirement homes. I feel like I'm just getting started all over again, Kleckner said. So if you're interested in a nursing career, Marion is also looking, and accepting people. I think that's wonderful. And I like to hear stories about people who choose nursing. And so I thought that was great. All right. So that's the end of our articles for today. So let's go ahead and, cancel. Let's go ahead and talk about what's happening here for the Nurse Shark Academy. So very excited. We are finishing up our season, but the Nurse Shark Academy has been nominated for a podcast award. So I'm asking everyone if you can, and I will put the information into the chat when we're done before I close out. So the comments will be there. Please consider voting for the Nurse Shark Academy for our podcast award. I do appreciate that. We're up for Women in Podcasting Award. It is a People's Choice Award, so I need your votes. So I'm just asking if you please help us out and doing this. So you can go to our website, thenurssharkacademy.biz, and go to the podcast tab, and it has the directions for voting for the award. So I'm excited for that. I'm going to say goodbye to you today, and can't wait to see you next week. We've got some exciting things happening for next week, and I'll give you more about what's happening with the Nurse Shark Academy and Baxter Professional Services Health Education. I'm just going to say bye-bye for now, and thanks for watching.